The cost for many life-saving drugs can set a patient back tens or even hundreds of thousands of dollars, and it's forcing more and more patients to make impossibly difficult life choices. Now, doctors are joining a grassroots effort to bring costs down. Dr. Leonard Saltz is the chief of Gastrointestinal Oncology at Memorial Sloan Kettering Cancer Center. He joins us to discuss. Doctor, thanks for being here.
My pleasure.
Let's ask this question first off. Why are the costs of drugs so high and going higher?
Well, of course, there are several reasons. One reason is that we have a system that allows the companies to charge virtually any price they want, because the Food and Drug Administration is mandated to evaluate whether a drug works or not, but not allowed to consider price in any way. Once they approve a drug, Medicare has to buy that drug, and they're forbidden from negotiating price, which means that they have to pay any price the drug company wishes.
Right, Medicare cannot negotiate at this point. What are you hoping to do with this group?
Well, this group and others who have raised issues about price are hoping, first of all, to start a dialogue and an awareness and help people understand that we have a problem here that is going to explode on us if we don't figure a way out of it. We have drugs that are costing in excess of $100,000 per drug per patient per year, and that's just not something that we can afford for everyone who needs it.
The response from the drug makers is, look, this costs a lot of money to develop, so we have to charge a lot for the drug. You don't buy that?
I don't buy that. I understand that developing a drug is difficult, and I understand that there are costs involved. But we have a situation where the actual value of the drug in terms of how much it adds for the patient's benefit is being completely separated from the price. There's no connection between what the drug accomplishes and what we pay for it. That simply doesn't make sense.
Your hospital and you have pushed back a bit. You're not stocking some of these drugs,
well,
right?
We had one drug in particular where we felt that the price was double and it was no better than an alternative, and we flat out said, we don't need this to give excellent care to our patients, and we're not going to do it. The result of that was within several weeks, the company cut the price by half.
They did.
Which shows that, in fact, the prices are, like all prices,
arbitrary,
liquid and open to discussion. There just haven't been discussions.
Do you need more hospitals to join that cause, to say, listen, we're not going to stock this?
I do believe we need more doctors and more hospitals to look carefully at drugs and say, this one is worth something, this one is not. This is worth perhaps not as much as they're asking for it. At this price, it doesn't make sense. We won't use it. If the price were to come down, perhaps it would make sense. There are some drugs that at any price don't make sense because they really don't add anything. All of these need to be looked at carefully and thought about.
The pharmaceutical lobby is powerful.
Yes.
They got a lot of money.
Yes.
They're going to push back against this. Can you give us an example of some of the most egregious costs out there that you've seen?
Well, we actually have seen some recent reports in the New England Journal of Medicine of using some of the new immune modulating drugs at doses that would cost $1 million per patient per year.
And how do they justify that?
And there's simply no discussion about it. It's simply that the company can charge what it wishes to charge. And even if we went down substantially below that, if we went down to just $100,000 or just $200,000 per patient per year, even that sounds silly.
And we talk about some of these impossibly difficult life choices. In many cases, these drugs are not cures per se. It's extending life for a couple weeks or a couple months.
Well, we have two parallel discussions. One is drugs that cost a lot but do a lot and extend life by many years. That's one important topic. And another is drugs that cost a tremendous amount and extend life by a matter of days or weeks. And that's another discussion that we need to have. Right now, we're all paying those prices without really looking at what we're getting for it.
What's next for you, and how long do you think it would take to potentially turn the tide?
As you point out, the pharmaceutical lobby is extremely large and powerful, and that is going to make it difficult to make changes in the laws. But we need Congress to be able to authorize Medicare to be able to negotiate price. We probably need to look at whether the way the FDA is mandated to review drugs makes sense and whether complete separation from cost considerations makes sense. The firewall that effectively exists between the FDA and Medicare, Medicaid probably doesn't make sense. But all of this is in the hands of Congress, and we need Congress to be willing to look at it and try to make changes that would be in people's best interest.
If somebody's watching this and facing one of these choices or knows a family who is, and they've just been told, look, you can try this medication, but it's going to be $200,000 or whatever outrageously high number, what do you tell them?
It's a really difficult choice. Different people are exposed to different levels of this financial toxicity on the basis of how much the drug costs and how much they are insured and how much they'll have to pay out of pocket. All of these factors come into play, and it is really tragic when people are faced with this kind of difficult decision.
You're not saying these drugs don't work, you're just saying that they're charging way too much for them.
I'm saying that some drugs work very little and they're charging way too much, and some drugs work really well, but they're charging way too much. These drugs are too expensive.
Dr. Leonard Saltz, thank you very much for being here.
Thank you, my pleasure.